Good morning. Good morning for everyone here, and good morning to the chair. Thank you, ma'am. Thank you for the talk for here. So I'll be speaking about monofocal IOls and what's new in the market right now. I have no financial interest to disclose. So normally the natural crystalline lens has a function of accommodating, giving a good clear vision at all our distance and maintaining our contrast. But now as we age, the dysfunction lens doesn't compensate for the corneal aberrations, but our new IOLs which is there in the market try to are overcoming this. So we have evolved like from era of PMMA silicon to an era of square edge and aspheric right now. So an ideal monofocal should have give us like a clear optical quality, uncompromised vision for distance, easy to implant, less of our PCO, glistening free, and less inflammation. But again, we ponder over a question like which is the best IOL model, what is like hydrophilic or hydrophobic is best, how do we prevent the PCO, or do we get anything more extra in our monofocals comparing to our multifocals, little bit at least. One of the most common complication we see is our PCO, which is again because of our surgical techniques or the IOL materials which we use. Again, it depends again on the optic size, edge profiles or the haptic materials. Usually a square edge on the posterior surface provides a barrier for our epithelial cells migration by inducing the capsular bend. So this doesn't allow your cells to migrate much, and the sharper end edges are better than that. So glistenings again, this are the fluid-filled microvacuoles which are there in the IOL polymatrix. So this is less in the hydrophilic ones. The refractive index again. So the more it is, again, the more amount of dysphotopsia which we've seen. So that's why the hydrophilic lenses closely mimic our biological tissue. So they give us better, chances of reducing our glare and abrasions are a little better in here. Aspherics, right now is the idea for aspheric IOLs to return our eye to the normal how optics it was. So now almost all the lenses which we come are the aspherics ones. So this increase our visual potential. I'll just brief something about the models which are there right now in the market right now. So Johnson & Johnson have come up with the new iHands, which is again the enhanced monofocal lenses. So these deliver around 30% better image in the lower light, and it gives a continuous change of your power from the peripheral to the center. So this creates like a unique anterior surface which gives you a little bit better intermediate vision, maintaining your good quality of your distance vision. Alcon has come up with their VVT, which is again a non-diffractive EDOF. So this has a stable force modified IOL haptics, which prevention for your PCO and everything. Biotech have come up with their iSert lenses, which are again an advanced monofocal lenses. So they have in that 5 zones in a diffractive segment, and these are a natural yellow hydrophobic material. Rayner has come up with the Ray1 EMV, which is again like done in collaboration with Professor Graham Bahet. So this reduces your dysphotopsia, and again this is also one of the new extended depth of lens which is there in the market. So comparing the three, I'm just giving you a normal comparison of all between the three. So Biotech comes from the advanced monofocal. Your Ray1 comes, they market it as a monofocal EDOF. Biotech uses like your wavefront technology. Rayner is using a spherical, decreasing a spherical aberration, and they're giving you a good intermediate at least up to 1.75 centimeters. Zeiss have come up with their monofocal Lucia, which is again a fully preloaded and hydrophobic acrylic. So they have a Zeiss optical concept which decreases aberrations. Again, in their Asphena model, they have the hydrophobic surface with the hydrophilic thing. So this decreases your neural adaptation and corrects that. So your best of both worlds is seen again with the hydrophobic and hydrophilic combined, which protects your PCO, no glistenings, and the hydrophobic surface. So ease of implantation is also in the matter, like which you get most of the preloaded ones, which gives you a no-touch sterility, reduces and quicker this thing. So the future lies in the different shape of materials and the monovision versus the EDOF, and again the light adjustable in the market. So I conclude my talk by telling an IOL is a package of both the physical characters and the material which is used. Despite a long evolution, there is no one clear IOL material which has all the ideal properties. The monofocal plus lens are like trying to give you a little bit more edge comparing to our multifocal ones, giving you an extra edge effect. Thank you. Thank you for your time.
Thank you.